All right, guys, I'm Meredith Peterson, the Executive Director with the Down Syndrome Association of Pittsburgh, here tonight with Dr. Tarin Santamaria, who is our pediatric psychologist in the Down Syndrome Center at Children's Hospital. So she does see pediatric patients and is going to share more tonight about positive behavioral strategies and just some interventions that how we can use with our kids and teens. So with that, Dr. Santamaria, I will pass it over to you.
All right, I'm just going to pull up my screen and my slideshow. Okay, can you guys see my PowerPoint? Okay. So as Meredith said, I'm a psychologist in the Down Syndrome Center at Children's Hospital. I just wanted to give a quick disclaimer. Every time I give a presentation, I just want to be sure to let everyone know that my presentations are strictly for education purposes, and I enjoy sharing information with others. But just because we talk today doesn't mean that we're establishing a therapeutic relationship. It's all just for education purposes. So a little bit about myself. I am a licensed psychologist. I am also a state nationally certified school psychologist. That's what I originally went to school for. I do have a private practice here in Pittsburgh, and I work at the Down Syndrome Center part-time. At Children's Hospital, I see kiddos out of the Bridgeville location, out of Pine Center, which is Wexford, and then out of the main campus. And right now I'm doing a whole lot of telehealth. In my position at the Down Syndrome Center, I focus a lot on challenging behaviors, social and emotional needs. Some of my favorite topics are sexual development, hygiene, boundaries, and relationships. I also talk with families and consult regarding education in terms of special education and IEPs. And then I also like to talk about individual and environmental safety. So just wanted to give a little bit of information about how to get into contact with me or get an appointment with me. All you have to do is call the Down Syndrome Center, and I have the number listed on the slide. If you press option 1, you'll get Camille, who is the scheduler in the Down Syndrome Center. A lot of times families make it to me by having meetings with some of our physicians, like Dr. Velody or Dr. McCormick. They might make a recommendation to come and see me, but you are certainly able to make an appointment yourself. And then what our appointments tend to look like for me is that the first appointment is always a psychological evaluation. I have to gather a lot of background information, get to know what the needs are, what the history is. And then from there, I kind of determine, what's the best type of service that might meet the needs of your family and your individual. So it might look like outpatient therapy with me, and this could be weekly, bi-weekly, monthly, or just as needed. I also recommend services that are outside of myself, such as wraparound, which is now called IBHS. I also make recommendations for PCIT, which is a type of outpatient therapy. And there's other higher levels of care as well that I can help families gain access to should the needs be there. Anytime I do a behavior talk, I always start with ruling out any medical concerns. Our individuals with Down syndrome are at risk for certain medical conditions. And so I think it's really important to make sure that our individuals aren't experiencing these things, which might translate over into a behavioral presentation. So some really big culprits that I tend to see in my appointments are things like constipation, disrupted sleep, sleep apnea, celiac disease, thyroid concerns. These types of medical conditions can present behaviorally. This is why it's really important that you keep up with the yearly appointments with the pediatrician, as well as yearly appointments if that's what's recommended by our medical physicians in the Down Syndrome Center. Some factors to consider when we're thinking about behavioral concerns as well as interventions and strategies are learning and cognitive strengths and weaknesses. Also want to consider, does this individual have a diagnosis of Down syndrome and autism, which is the DSASD? Different learning and memory patterns. We want to know strengths and weaknesses with that. Learning style. So individuals with Down syndrome tend to be visual as opposed to auditory learners as a strength. Language processing and communication skills are something to obviously consider. Executive functioning skills. Those are skills that are housed in the frontal part of the brain, which is the last to develop because your brain develops back to front. And in the frontal lobe houses executive functions. So that's an individual's ability to organize, plan, inhibit behaviors, do problem solving, understand consequences of actions. And those skills aren't fully developed till the early 20s. And that's not to say that we don't intervene and do behavioral strategies before then, but that's just something that our population tends to have some difficulty with. And then we also just need to consider development and developmentally appropriate expectations, which may be different than age-based expectations. So if you have a 10-year-old with Down syndrome and a 10-year-old without Down syndrome, you might have different expectations for that individual based on their skill level and their development. Some other things to think about is behavior change. So when you start doing interventions, it takes time. We use the phrase progress, not perfection. So my goal is never for things to be 100% perfect, but it's that there's improvement. There's a decrease in challenging behaviors and an increase in those target skills that we want to see. We cannot expect behavior change to happen overnight. If that's a goal that you set for yourself, it's just not realistic. So there's a saying that you can't walk 10 miles into the woods and expect to get out on 5. Like, it's going to take a long time. We have to really put in some work. Making sure that your individual's team is all on the same page. So consistency is so important. I can't stress this enough. And that's not just parents, mom and dad being on the same page, or caregivers being on the same page, but that's also babysitters and grandparents and the teacher and the para, everybody addressing these behaviors in the same fashion, using the same evidence-based interventions is really important. And then interventions might not always work 100% of the time. And that doesn't mean that it's failing or that it's ineffective. It just means we're human. So there might be days that are rough days, and that's okay. Just being persistent and really implementing the interventions to fidelity, which means the way that they are designed, and doing so consistently is important. There are also some times where we might implement an intervention and we notice behavior actually gets a little bit worse before it gets better. There's a fancy term for that, and it's called Extinction Burst. It is no fun, but it does get better. So for example, when you use planned ignoring, we'll talk about this later, planned ignoring, there's typically an extinction burst where the kiddo does a little bit more and a little bit more to get attention before it decreases, the attention-seeking behaviors decrease. So I wanted to start by also talking about the functions of behavior, which is like the why the behavior is occurring. So we need to figure out why it's occurring before we know how to address it and what strategies to use that are most appropriate. So a lot of times at school, you might hear the term FBA, functional behavioral analysis. So this is when somebody in the school district goes in, observes the behavior, and tries to figure out the ABCs. In a school district, it tends to be a school psychologist, a behavior specialist, or some other specialty type role. And the ABC of behavior stands for antecedents, behavior, and consequence. So the antecedents is what happens right before the behavior. And then the B, the behavior, is what it actually looks like. And C is the consequence. And when I'm thinking of consequence, I'm not thinking of punishment. It's just what happens after the behavior occurs. And so then when we know why it's happening, we know how to plan for interventions. We know what skills need to be taught. And we know how to maybe reinforce what we want to see more of. When I think about the functions, there's a few different functions, and the acronym is SEAT, and it stands for sensory, escape or avoidance, attention, and tangible. And we're going to talk a little bit more about that in my next slide. So when a behavior's function is sensory, or sometimes people call it automatic, that's a behavior that gives the individual access to sensory stimulation. So their body is seeking some type of sensory input, and then when they do it, it feels good, which means it's probably going to be self-reinforcing, which means it feels good, so I'm going to do it more and more. And so when a behavior is sensory in function, it can occur at any time. It can occur in the presence of a ton of people, or just when the individual is by themselves. And the way to respond, or the intervention to do, is probably doesn't need an intervention. When a behavior's function is sensory, the individual needs it for some reason. So we don't want to stop that from happening. The only time that I ever recommend an intervention for behaviors that have the function of being sensory is if it is impairing the individual's functioning in some way. So for example, I have a lot of kiddos who do really loud vocalizations as a sensory seeking behavior. If that's happening in the middle of class and it's maybe disrupting their learning or others' learning, then maybe we'll try to shape the behavior or find out ways where it won't be in the middle of class, but maybe we can have a sensory break where they can vocalize as much as they need to outside of the classroom before coming back in. So there's other things that we can do. But typically sensory seeking behaviors do not need an intervention. But it is important to figure out, is this truly sensory? Because I think that there are sometimes sensory seeking behaviors that other people don't identify as being sensory seeking and think that they are a challenging behavior or a problematic behavior. So this one can be kind of tricky, but it's really important. The next function of behavior is escape or avoidance. So that's when the individual removes themselves for an undesired situation or wants to avoid a non-preferred task. It tends to occur when something's viewed as too hard, too boring, just they don't want to do it or they don't want to be there. And how to respond to that type of behavior is we're going to teach the individual how to request a break. Maybe we're going to break up tasks into smaller tasks so that they seem more feasible. And we're going to give choices of activities. So if the kiddo needs to do reading, math, and writing, maybe letting them choose which task they do first and giving breaks in between and breaking it down to smaller pieces so it seems more manageable. The third function of behavior is attention. The behavior provides a reaction from others. So I do this behavior and other people react to me, or other people give attention to me. This probably occurs only when the individual is around other people and has an audience, or they are desiring social interaction with another person. How to respond to attention-seeking behaviors. Like the biggest intervention is called planned ignoring. And we're going to talk about this a little bit more later, but essentially planned ignoring is when we purposefully ignore the challenging behavior while planfully giving attention to more positive behaviors that we really want to encourage. We're going to teach the child how to request attention or how to receive positive attention rather than negative attention. This one's it's kind of a tricky one, but I see it a whole lot in my practice. Tangible, that's the other function of behavior. So that's wanting to obtain an object. So I think about this when the child wants to obtain the iPad or when the child wants to obtain a snack. So it's when they want something like an object or an item, not attention, but something tangible. So the behavior provides access to a preferred item or activity. It tends to occur when the child wants a specific item. And how do we respond? We have to teach this child how to wait, how to accept no, how to ask for the item appropriately. So I have a couple examples and I'm going to read it and then somebody can shout out and give me what they think that the function is. So I have an individual in example 1 that rocks, chews, vocalizes, gyrates, or maybe even waves an item in the middle of academic instruction. It's also observed when the individual is alone in their bedroom. So what do you guys think the function of this behavior is? Is it sensory, attention, escape avoidance, or is it to gain something tangible? Anybody?
In the chat, it's been everyone saying sensory.
Oh yes, I'm sorry, I didn't even look at the chat.
Nope, I got your chat.
Okay, so yeah, that is sensory, and the key is that it can be when the individual is by themselves, but also in the presence of potentially other people. And then some of the examples that I gave are common types of sensory seeking behaviors that I've observed from kiddos in the Down Syndrome Center. Okay, so my second example is a parent directs the individual to clean up their toys. The individual exhibits the stop and flop, which is when they just fall to the floor like dead weight. They begin to cry and begin to yell. The parent then engages with the child, attempts to convince them to stand up and to clean up, but the situation then persists. So when I'm thinking about this behavior, some things to think about is the parents directed the individual to do something, the behavior happened, and the parent the situation persisted. So what do we think the function of this behavior is?
Avoidance is what was put in the chat.
Yeah, so the kiddo wanted to not do that non-preferred directive. They were doing escape avoidance behaviors. That is not what they want to do. They do not want to stop playing and they do not want to clean. So that the antecedent, the A would be the directive, the B or the behavior is the stop and flop, crying and yelling. And the C or the consequence in this situation is the parent was trying to convince the kid. So come on, stand up, let's clean, let's do it together. You clean some, I'll clean some. And then the situation kind of persisted after that. Okay, example 3, mom is helping a sibling with homework.
Sorry, Dr. Marie, can I interrupt you for a second?
Yeah.
Somebody was starting to ask a question.
Oh, I'm sorry.
Oh.
Hi, it's Nicole. How are you?
Hi.
I have a question in regards to what you were just talking about into attention-seeking behavior.
Yeah.
So Skylar is almost copying her 1-year-old sister. So her 1-year-old sister is in the hitting, biting stage.
Mm-hmm.
And Skylar is now going back to that. She'll hit, she'll steal toys, she'll do all this stuff just to mimic her baby sister. How would you correct that without yelling or getting upset?
That to me sounds complex though. So I'm not sure if the function is necessarily attention. My guess is that there's probably a communication need or a skill deficit, maybe with communication or maybe with social skill. So a skill that might need to be taught outside of that situation. And then responding in that situation. So trying to observe and determine, is your child doing that because they want to obtain? So when the sibling does it, do they obtain something? And whether it is an item or is it I'm obtaining attention and reaction? I'm not sure in that situation. I wasn't exactly clear. But my guess is that that might have more than one function. It sounds like it's more complex.
Yeah, it's definitely more complex in the sense of like Ava, the 1-year-old, she'll just take a toy or she'll yell or hit. She's young. And then Skylar's almost seeing that when we're like redirecting Ava, like, no, we're going to do this. So I don't know. Like I said, I don't know how to move forward with that and how to address that with Sky.
Sure. I think that, what's important to note is that a lot of our kids have skill deficits as a foundation. So I'm thinking difficulty expressing a want or a need, or difficulty saying like, hey, I want that toy, or can you share that with me, or it's my turn, or no, I don't want you to take this from me. And so we have to teach those skills, not in the moment after the behaviors happened, but in a neutral moment during a teaching time. And then also trying to figure out in that situation, is it truly that they're mimicking the behavior, or have they learned, hey, when sister does, X, Y, and Z, she gets something. So should I do it? So I'm not sure if it's necessarily mimicking, or have I figured out this works for my sister, so I want to do it too. I don't know. It's, sometimes when people present behavioral scenarios, it's hard without getting more information or observing it myself. It sounds like it might be or it might be to gain something, but maintains by attention. So maybe she wanted a toy, but then when she got attention, it kept the behavior going. Again, might have had two functions. But I'm going to talk a little bit more about attention-seeking interventions and strategies in several slides moving forward. So maybe hang tight a little bit, and then we can talk again.
Well, thank you so much.
Sure.
Dr. Santamaria, another request. Are you able to jump back a slide? Someone wanted to see that real quick.
Yeah.
Ada, is that what you needed?
Yes, please.
Okay. Wonderful. All right. Thank you. You can go ahead and go on. Thank you.
Sure. Okay. So my third example is when the mom is helping a sibling, the individual swears and then looks at the parents, and then all the siblings laugh. And the siblings kind of think it's funny. So what do you all think that the function of this behavior might be?
Is there anyone that wanted to answer this one? Oh, attention.
Yes, it's attention. So what I wanted to point out is the parent was helping a sibling. The individual swore, cursed, said a bad word, and then looked at the parents and siblings. So it was kind of like, hey, I said this naughty thing. Did you hear me? And then the siblings laughed. So they got a reaction. So the antecedent is that, everybody was kind of doing their own thing. The behavior would be the swearing, and the consequence is the reaction of the siblings laughing at the child. So in that instance, the siblings laughing is actually maintaining or reinforcing the behavior, which means this individual got attention and reaction. They got what they wanted. So the likelihood that this behavior will happen again is increasing. And this is tricky because if you have siblings that are maybe younger or that react strongly to an attention-seeking behavior, trying to talk to them and encourage them maybe not to react to attention-seeking behaviors can be really tricky. I have that conversation a lot with parents, trying to get the siblings on the same page. So maybe we as adults might do an okay job with doing planned ignoring, but getting other people in the home who maybe aren't the adults on the same page is really tricky. Was there a question, Meredith? I thought I saw the chat box go.
We were just commenting back and forth how much we're enjoying this. So.
Oh, thank you. Okay.
It's all good feedback. Carry on.
It just flashes at the top of my screen, so I was just curious. Okay. The fourth example is individuals repetitively asking for the iPad. The parent keeps saying, no, we got other stuff to do. The child starts escalating. So maybe the first time just asking, then asking and yelling, and then asking, yelling, and stopping. So it just kind of keeps incrementally going up. Eventually, it's too disruptive. It wears down the parents. The parents give up. Here, take it. Take the iPad, go. So what do we think the function of that behavior is? You can shout it out or put it in the chat.
We have tangible.
Yeah, to obtain something tangible. The kid wanted the iPad. So the antecedent in this situation, I didn't really give enough information for that, but it was essentially that the kid wanted this item and asked for it. The behavior is repeatedly asking and escalating. And the consequence was that the parent gave in. So the kid escalated to a point that they wore the parent down. The parent had had enough and gave the kid the iPad because it was just too much. They couldn't hold strong in that situation and continued to decline it. So the problem with this is that if your child can get you to a level where they wear you down, that every single time they want something, they're going to go right back to that level or more. And so it ends up getting worse and worse and worse if you're not consistent in giving a firm no, because they will just keep trying to push you to that point. We call that limit testing. So kind of seeing what your limit is and then going more and more and more and towing the line more. And we're going to talk about that in a little bit too. So I alluded to this earlier when I was answering the question, is that we really have to teach skills and teach behaviors. So when I talk to parents about challenging behaviors, I try to really hit home that when our individuals have challenging behaviors, it's not necessarily malicious. Our individuals don't want to upset their parents. They don't want people to be upset with them or mad at them. A lot of times there's a skill deficit as a foundation. And so we really have to teach. And so some of the things that we have to teach are replacement behaviors. So sometimes there's a skill. Ooh, sorry, I'm in the way over here. We have to teach a related skill that serves the same purpose as a challenging behavior. So a skill that allows a child to get their wants and needs met in a more appropriate way. So for example, if you're on the phone and your individual interrupts you all the time, like mom, maybe you're going to teach them to wait, or teach them how to tap your hand, or teach them how to write a note so that it's not as disruptive of a behavior. So we have to teach the individual in the area of need. You might teach the individual how to gain attention more appropriately, teach them how to request a break, teach your individual how to walk down the hallway inappropriately. These are all really important skills to teach which would likely decrease the behavior. So when we think about addressing behavioral concerns, these are like proactive or preventative strategies that will decrease the behavior. A lot of times people just want to focus on when this happens, how do I respond? And it's really hard. And if you don't ever teach the individual the skill, we can't expect the behavior to change because the skill deficit will always be there. So we really have to think about behavior and think about what is the child missing and how do we help by teaching as well as doing behavioral interventions. But I consider this part of it, the preventative and proactive strategies. So it's much easier to be proactive to reduce or prevent behaviors than to react after the fact. So for example, if your individual slugs his sibling, you know, how do you respond after that? It's kind of tricky, but if we prevent it from ever happening, that's so much better, which is easier said than done, I know. So maybe your individual slugged their sibling because their sibling took their toy and they don't have self-advocacy skills to say, don't take my stuff. Or maybe they have really low frustration tolerance and they can't calm their body down really well. So they go 0 to 100 and impulsively hit others. So we need to teach coping skills and how to problem solve. So this is what I'm talking about proactive strategies and also teaching. So now I'm going to go through a list of common challenging behaviors that parents bring to me, and we're going to kind of work through it together. So non-compliance is always the big one. So not doing what the parent essentially asked the kiddo to do. So the adult gives a directive, the kid might passively refuse by just ignoring the directive or standing there and not doing it what they're told, or the individual might verbally refuse and say, no, I'm not gonna, or they might do the opposite of what is asked. Whatever it is, it's not following the directive. They might argue, try to negotiate. So some preventative and proactive strategies to try would be a visual schedule, a first then phrase. And I have some examples I'm going to show of some of my like visual schedule things. But just real quickly, here's an example of one that I use, and it just has different tasks, and then at the bottom would be the reinforcer. A first then phrase would be like, first we're going to eat dinner, then you can have your iPad back. Or it might say, first we're going to do math, then you can have a break. And this is an example of a first then, or these are Velcro, so I always make a bunch of different pictures that you can use, but this says first toilet, then iPad, or first bathroom, then iPad. Countdowns and timers are really helpful. So if your individual needs to transition away from something, giving them countdowns and preparations, so that way they're going to be likely more compliant when the switch happens. We're going to talk about transitions in a little bit too. So verbal countdowns or timers are good. And then also pausing. If your individual is, for example, watching TV and you're like, hey, you need to clean up your toys, you could always pause the video game or pause the TV and say, clean up toys, then you can have the TV. And then that way you know that they're already motivated by it because they're already watching it or playing it. And then the second they're done cleaning up, you can pop it back on. The stop and flop. So the stop and flop is a term that I believe the Down syndrome community gave, and it was so popular that we named it. I had never heard it until coming into the community with my work through the Down Syndrome Center. And I know that some other families call it different things, but the stop and flop, you'll read it in text in some of our books, like the David Stein book, which I have here, and other articles or presentations. So essentially what it is the individual stops what they're doing, flops to the ground, refuses to get up. And sometimes it looks like a tantrum too, where the individual might cry or yell or whine. It is really hard. So the bigger the kid, the bigger the problem. When a kid is really little and stops and flops, you might be able to like swoop and go and swoop them up under their armpits and move along. When an individual is bigger, you probably can't do that. And so it's really challenging. This is a toughie. So it's really important, again, these preventative and proactive strategies. So it's really important to build in motivation proactively. I have a kiddo that likes to stop and flop in the hallway, which is a big time of transition. So going from one class to the other class. And so that's a transition. So I think about transition supports. So this might be motivating the kid to make it through the hallway to the destination. You're going to try and maybe reinforce appropriate walking. So every few steps, give reinforcement. And this might just be verbal reinforcement. I like the way that you're walking. You're walking awesome. You know, or it could be, you know, breaking off pieces of a snack and every now and then giving it to them. Also, you know, one thing that I've tried in the center is when I'm transitioning kids from either my office to the waiting room or vice versa, I'll say, hey, do you want to walk like a spy or do you want to walk like a cat? And just giving them that choice. And then it kind of seems like a fun game and I'll join them. They're more motivated to walk appropriately, especially if I know that that's where the behavior tends to occur, is during that transition from point A to point B. Another thing to try would maybe be, is there light at the end of the tunnel? So for example, if your individual stops and flops from the house to the car, once they get to the car, is there some motivator that can be there? Can they choose what music they listen to? Can they get a special activity or task once they get into the car? That way that motivates them to make it there. First then phrases are really helpful. Again, choices, visual schedules, and then also social stories. And I'm going to talk a little bit about social stories later. So attention-seeking behaviors. And then there's these two concepts that are talked about a lot in our community and beyond. The first one is planned ignoring, and the other one is respond but don't react. And I know this slide looks very information heavy, so I'm just going to break it down. So planned ignoring is when you ignore the challenging behavior. And that means we're not going to react with a facial expression. We're not going to react with words. We're not going to react with an eye gaze. You can even turn your body and pretend like you don't see it happening, but you're going to give no reaction and remain neutral. This is going to happen, for example, if your individual is looking at you and swearing, like my example said, or maybe it is your individual is touching something that you told them not to touch. The respond but don't react came into play because we can't ignore every behavior. For example, if your individual runs to the road and there's cars on this road and it's a busy road, you're not going to turn your back and use planned ignoring because it's not safe. So in that instance, you're going to use what's called the respond but don't react method. So you're going to respond by going and obtaining the child, bringing them back to safety, and then you're going to not react. You're going to use planned ignoring. So when I think about planned ignoring, we have to ignore the challenging behavior, but then give tons of attention to the appropriate behavior. So this is the concept of differential reinforcement. So and that's a fancy way of saying teaching the individual what's going to get them attention and positive response and what's not going to get attention and what's going to be ignored. So that's a really important thing. So for example, there's individuals who come into my office and they might climb up on the table. And that is not safe to me. Like maybe at your house or table, like you're cool with it. In my office, no way, Jose, because I don't want to get in trouble by the hospital. So I'm going to tell the parent, hey, get your individual off the table, put them on the floor, and we're going to ignore this. Don't look at them. Let's keep talking, doing what we're doing. But then the second they put their bum in the chair, I'm going to look at them and be like, oh my goodness, you're doing a great job putting your bum in the chair. That was fantastic. I like how you're sitting like a big girl. Great job. So differential reinforcement is I did not give attention to them standing on my table, which was clearly attention-seeking behavior, but I am going to give attention for them sitting appropriately with their bum in the chair. And then keep in mind that, again, we're not going to use planned ignoring for unsafe behavior, so please do not go to Dr. Velotti saying, well, she said to ignore him when he runs with the knife. They know that we are going to use respond but don't react. So we're going to make sure the individual is safe and then planned ignoring, especially when safety is at risk. Okay, so some other behaviors that are pretty common in our population and beyond are power struggles and limit testing. So power struggles are when the child seeks to control. They want to make their own decisions. They don't want to comply unless things are on their terms. Preventative and proactive strategies are we're going to allow for control in instances where that is possible. We're going to make sure that the individual has buy-in with interventions and promote independence. So this is providing the individual choices. So for example, if your individual really wants control in the morning routine, giving them choices. Hey, do you want to go potty or do you want to brush your teeth first? Do you want to wear this outfit or this outfit? And that's not giving the child free range. So for example, potty and brushing teeth are two things the kid must do regardless, but it doesn't really matter to us which order it happens in as long as it happens. And when you give the individual choices of outfits, they're going to be weather appropriate outfits that are okay with you, but which one doesn't really matter. And so this can also be for snacks, like, hey, do you want graham crackers or do you want Cheez-Its? Giving that sense of control. And this is really good for buy-in with intervention. So I'm going to talk in a few slides about behavior systems. And I think what's really good is letting your individual choose what reinforcer that they're going to earn. So if you do X, Y, and Z today, you can have this as your reinforcer, and letting your child choose what this is. Obviously, it's not going to be like, hey, we're going to go to Kennywood, but it might be, do you want to play Uno? Do you want to have a treat, or do you want to call grandma? And, give the child some limits around it, but give them ultimately the choice. And then also in power struggles, there is a time where you just have to disengage. So if this individual continues to try to negotiate and continues to pick plan C when you offered A and B, there's a time that you just have to disengage. And so that might mean leaving the room. It might mean shutting the door. And it's just going to mean, this is your options. These are your choices. Let me know when you're ready to pick. And that's it. Testing. It is, when the individual tries to see how much they can get away with, kind of toe the line, push boundaries. They tend to act out more for new people who they're not quite sure where the boundaries lie, or even people who maybe aren't super consistent. There's a lot of limit testing that might happen with them. So it's really important to have clear behavioral expectations, clear boundaries, consistency among caregivers, and that means parents, babysitters, teachers, anybody on your child's team. And then something also that's helpful is the use of a reinforcement system or a token economy, which I think I talk about in future slides. So then sometimes I say, who's the weak link, or who's the person that's going to get pushed back. And a lot of times this is a new person, like I mentioned before, somebody who maybe the individual isn't sure where their boundaries and limits are, or it might be the person who tends to kind of flip-flop on how they implement certain strategies or interventions, or who they know, if I push this far, I can get what it is I want. So it tends to be the person who's not as consistent, or maybe not as firm, or not using interventions as designed. Some other behavioral concerns in our population are darting and elopement. So some people define these differently. So I think about operational definitions, and that's just a fancy way of saying like what I'm exactly talking about with this behavior. So darting, I think of darting as running from an adult, and it could be running down the hall, going in a different direction from the individual. And then when I think about elopement, I think of that as leaving the assigned area. So leaving the house, leaving the classroom. That's what I think of when I'm thinking of elopement. So for example, if you're in the grocery store and you're in an aisle and your individual darts down the aisle from you, or runs down the aisle, I consider that darting. If you're in your house and you're in your shower and you hear your front door open and your child's out of the house, I consider that elopement. So obviously some strategies that we're going to use for both of those are the respond but don't react methods. So darting away from a parent where you can't see your child, or eloping from the house. I consider those both to be unsafe situations. So you're going to respond but don't react. You're going to get the individual, bring them back to safety, try to remain neutral, not give too much of a reaction, and then ignore that, but the next time they do something positive, give tons of attention. So darting and elopement tend to get the most reaction out of people. So I always use the example of the individual running towards the road, because that is the most unsafe, heart-stopping moment that a parent can probably experience. And you are probably shouting like, get away from there, there's moving cars. It is so hard to not react in those situations. Or if your individual is wielding a tool, that's really unsafe. So a lot of times it gets these huge reactions, and then the child might think it's funny. Or for example, the darting, if you're in Target and your individual darts from you and you're yelling at them to stop and kind of running and you're trying to carry all this stuff with you, it turns into a game. The kid might think it's funny, and then they're encouraged to do it more and more. So it's really important to try and limit your reaction and response as much as possible. So when I think about proactive strategies, trying to control the environment. So if I know that Susie is an eloper and we're in the classroom, I'm going to position her away from the door. She's not going to be the closest desk to the door. If she has an aide, there's going to be an aide between her and the door. We're going to keep doors shut in the house. I'm going to work on locks, putting locks up high, chimes on doors and windows. If your individual darts in stores, it's best to put them in a cart or a stroller if possible. Have them hold hands. You can come up with some fun thing. Maybe your individual can hold on to a string that's on your purse strap or on your belt buckle. So any way to make sure that they are with you and safe. Practice safe walking. So again, that's like a skill that we're going to teach ahead of time, is how to walk appropriately, how to stay with your parents, stay within eyesight, or whatever your rule might be. So maybe they don't have to hold your hand, but they're not allowed to go more than 2 steps ahead of you. That's, what you're going to practice and teach. Then you're going to do lots of reinforcement for positive walking. So anytime that you're out in the community, it could just be verbal. It doesn't have to be anything big or contrived. Just like, hey, you're doing a great job staying with me. Thank you. You're doing fantastic. Giving rewards at the destination is sometimes another strategy to try. You can distract the individual with a helper task. So for the kiddos that tend to dart down the hallway at school, a distractor task might be like, hey, walk next to me and let's go give this special note to the secretary. And it doesn't have to actually be a note. It can be a folded piece of paper with a scribble on it, but the secretary might know it's coming. And then the secretary might say, oh, Matt, great job. Thank you for bringing that to me. That was fantastic. I saw you walking down the hall like a big boy. So that person also gives reinforcement and encouragement. But the task of being a helper and carrying this paper to the secretary was really good practice. It distracted the kid. It kept them on task, which was walking down the hallway. Another proactive or preventative strategy to try is the use of stop signs. So if your individual is in a loper, putting little stop signs by the front door is probably a good idea. And here's an example. This is just a stop sign that I got off Google Images, and it's laminated. You can tape it next to the door. You can put it next to the front door and back door. But then you also want to practice. So you don't want to just like pop this on your house and expect your individual to know what that means. So the next thing that you might do is you might put it there and then draw attention to it and say, oh, that says stop. That means we stop. We don't go to the store unless mom or dad or whoever it is, or grandma or grandpa are with you. You have to hold hands and then we open the door. So you'll kind of come up with like a little routine associated with the stop sign. And then you really want to be consistent and follow through with this. So every time you get to the door, oh, see the stop sign. Okay, that means stop. That means hold hands. That means wait, or whatever your language might be with that. So transitions is the next one. And I know I've kind of talked about it a little bit sprinkled throughout this. Individuals with Down syndrome may experience the world as being unpredictable. So if we think about memory and needs, our individuals have difficulty transferring information from short to long-term memory. So things like repetition and sameness really help. When there are things that are unpredictable or new or different, or like a transition, stopping one thing and then going to the next, it can lead to anxiety. When a routine is broken, an individual might react strongly and negatively. Also shifting tasks. So when I think about transitions, I think of transitions as going from point A to point B, but also from one task to another task. So it doesn't just have to be car to the store. It might also be stopping the iPad to eat dinner, or doing homework and then getting to play. Those are all transitions. So some preventative and proactive strategies to try would be a visual schedule. So this might look like one of the things that I held up here, and it just has an outline of what the 4 tasks for the get ready routine, although it's in reverse order. Or it might just be you saying it verbally, or it might be a written list. It might be something on the whiteboard. However you want to make the visual schedule, you might use a timer. So the example, this is called a time timer. And why I like it is because you can crank it to 5 minutes or any minutes that you want. But as time goes away, the red gets smaller. So our individuals, the concept of time is abstract. So I think what's good about this time timer is that you can say, hey, when there's a lot of red, you got a lot of time. When there's a little bit of red, that means you only have a little bit of time left. So it's this extra visual. So you can just turn it and say, hey, you've got 5 more minutes of TV, then it's time to do homework. And that's a transition support. And then you can also give verbal countdowns. So saying, hey, you've got 5 more minutes, and then 3 more minutes, and then 1 more. Okay, in 30 seconds, we are all done TV, and then it's time for homework. And then first then phrases again. So I use this as a visual support for a first then phrase. You don't have to do something fancy like this. You could just say, first homework, then whatever the next thing's going to be. So if you tend to want it to be the less preferred and then the more preferred. So first go potty, then we can read a book together, or first go potty, then treat. Tantrums are another common behavioral concern that I talk about a lot with parents. We have to think about, why did this tantrum happen? And sometimes this can be tricky. So what's the antecedent? What's the A in the ABC? So is it that the individual was denied additional electronic time? So maybe I'm on a video and I want 5 more minutes, and you said, no, we are all done. And then the tantrum occurred. So in that example, the function of that would be the tangible item. I want to keep playing my electronic. I want to keep playing my video game. So some things that you don't want to do, or you don't want to engage, you don't want to try and give a really lengthy explanation. You don't want to keep giving more and more time, because then that's kind of limit testing, where I'm going to negotiate for more. And then next time I'm going to do it more. And then next time it's more and more and more. Some things that we do want to do is give countdowns for that transition. You can use the time timer I just showed you. You're also going to teach, again, a skill deficit might be functional coping skills. So if your individual has a tantrum when they're told no, they have poor frustration tolerance and maybe difficulty accepting no. So you're going to teach how to accept no. You're going to teach coping skills. You're going to maybe prompt and model for those functional coping skills. Disengage, wait until the individual is ready and calm. These are all strategies to try, as preventative and proactive strategies. And then reinforce the use of it. We can also work on de-escalation strategies, which would be kind of like not really preventative or proactive, but after the fact, although it might be preventative if they're escalating before the tantrum. And try to intervene early. So if you know your child's like hype up behavior, if you know, like, first my kid yells, and then they stomp, and then they clench their fists and growl, and then they just fall out and flop to the floor and hit and kick and throw items, you know that there's like 5 behaviors before it gets to 100 that maybe you can intervene and stop it there and de-escalate the situation. So some tips and tricks, some things that I think anybody could use on any day, no matter what the behavior is, no matter what the age of the individual is. And the first one is explicit directives. So I think that we, as adults, sometimes get stuck in using too much language. And what's really important in our individuals is that a lot of our individuals have communication delays. So the most explicit and least amount of language, the better. So an explicit directive, rather than saying, clean up the living room, because although that's a short phrase, that's a very broad meaning. Like, what does clean up mean? If you look at, my kids' playroom right now, and I said to clean up, there's about 500 toys. And what could that mean? Could that mean cars? Could that mean the whole thing? Could that just mean the Barbies? Who knows? My kids are going to look at it and be like, I don't even know where to start. So that wasn't explicit enough. When we give an explicit directive, we're also not asking the question, do you want to clean up the living room? Like, no, why would your kid ever say yes to cleaning up something? There's no chance. So you're always going to get a refusal if you ask. You're going to be really short and sweet. So I want you to put the cars in the blue bucket, or I want you to pick up the Barbies and put them in the basket. So you're just going to be really direct. So you don't have to give this really long explanation. You're not going to ask a question. You're just going to be super specific. So labeled praise kind of has a similar philosophy. So a lot of times we use good job, or I like that, but that's really broad. Like, what did the kid do a good job of doing? And the more explicit that we can be with our verbal praise, the better, because then the kid knows, oh, that's why mom is telling me good job, or that's why dad is, really excited for me. So labeled praise is when you be super specific. So I like how you did this. So instead of saying good job or thank you, I really like how you sat with your bum in the chair. You did a great job putting the car in the bucket. The individual knows why you're excited for them because you said it explicitly. And then when they know, they'll do it more and more and more. Because who doesn't want that praise and those feel goods? It increases self-esteem. It helps build and repair the relationship. So making sure, if you say thank you or good job, just add on what it is at the end. So thank you for putting your trash in the trash can. good job putting your placemat away. I like how you walked with your feet slowly down the hallway. Just being super specific. So another tip and trick is social stories. So I talked about this or alluded to it earlier. Social stories they don't have to be like a storybook. You can make them yourself. There are also ones that you can purchase, but it describes a situation, an expectation, and a desired behavior. So an example that I gave was that there was a teenage client of mine who needed to go prom dress shopping with her older sister. She wasn't going to prom because she wasn't old enough yet, but her older sister was. She went to the store. It was very overwhelming. She had tons of challenging behaviors and the whole family had to leave. They left without a dress. So then the family was like, oh no, what just happened? Why did this happen? And what they figured out was that this individual had no schema, no frame of reference for what prom dress shopping meant or what was expected of them during prom dress shopping for the sister. So the parents came up with this idea to make a social story. So they essentially took pictures of the front of the store, took pictures of the inside, took pictures of the dressing room, kind of wrote some really explicit statements out on what to expect. Like, we're going to go in there, Sally's going to try on 10 dresses. This is what the store looks like. We're going to sit and observe. We're going to help her pick out a dress. Like, it just has to be explicit. But what it does is it helps reduce anxiety, lets the individual know what's expected of them, what's expected of others, helps the individual understand a situation, and it teaches them how to behave. So another example is sleep studies. So a lot of our kids, the recommendation is sleep studies before the age of 4. But what's a sleep study to a kid? Like, no kid knows or has a working definition of what a sleep study is until they've been there. So what a social story for a sleep study would be is it would show pictures of the room, of the apparatus, maybe of the person that's going to be in there working with them. It's going to say, like, what's expected of the child, what's the child going to do during it. It might show pictures of the probes taped to their face. It might be, oh, mom's going to be with you, don't worry, this is the bed that she sleeps in. Just what to expect, how you're expected to behave, and what the outcome is. So some social stories, there are ones that you can buy. I really like Julia Cook books, which are more like illustrated children's books, but they always have like a social emotional theme. So a social story could be about anxiety, or it could be about being a tattletale, or saying mean words. So Julia Cook books are really great. They're on Amazon. A lot of times they rhyme. They've got all these really great, fantastic pictures. You can make them yourself. It doesn't have to be fancy. It could be one page with just pictures and sentences, or it could be a couple page book that you staple together. There's also a website that's called Teachers Pay Teachers, and it's literally teachers that make things like social stories or visuals for very minimal cost. So if you needed a social story about toileting, or even one about a sleep study, you can find them on that website as well. So natural consequences is another kind of tip and trick. So the natural consequence essentially means, like, hey, this kiddo made a mess, they have to clean it up. So they have to undo what they did. So for example, if the kiddo took marker to the wall, they help to clean the wall. One thing to be careful of is, in these situations, making sure that the consequence is not reinforcing to the individual. There was an example in the new toilet training book that the kiddo really liked to do laundry. So when they had an accident, the parents were punishing by making them clean up and do the laundry, but the kid really liked doing the laundry. So then they kept having accidents and making the mess so that they got to do the laundry. So that's why sometimes a natural consequence can be tricky. You just have to make sure it's not something that your individual actually prefers to do, because then it'll reinforce it and they'll keep doing the behavior to get to do the consequence. So some other things that we could try is giving 2 prompts and then hand over hand. So that's essentially where you tell the individual to do something. You follow up with 2 prompts, and then if they still don't do it, then you can gently guide their hand to help them do it. So for example, if I tell my son Hudson, hey, you need to put your cars in the car bucket, and he doesn't do it, and then I'll give him 2 more prompts, put the cars in the bucket, the cars in the bucket, and then if he doesn't, I'm going to help him. Okay, well, I'm going to help you, and I'll pick up the car with him and put it in the bucket, and pick up another car and then put it in the bucket. This is gently, and just making sure that you follow through with the direction. So when you tell your individual to do something, You don't get distracted and go do other things without the house. You're going to really remain consistent and follow through. So a tip and trick is teaching about emotions and feelings, and also functional coping skills. So before, when I was talking about, a lot of times there's skill deficit, that's a foundation or kind of bubbling under the water, and behavior is what we see up top. This is something that tends to be a skill deficit. So not understanding feelings and emotions, maybe not having the words to express them appropriately, and then not being able to calm my body down once I'm escalated. Either this could be anger, frustration, anxiety, worry, sadness. Functional coping skills are really helpful. So these are just a few, and they're really easy. When I think about functional coping skills, I try to think of what's free, easy, accessible, I can do anywhere, and that's anything that's on your person. So if you say, oh, well, you know, I'm going to go smell my essential oils, like your kid's not going to be able to smell lavender in the middle of class. So let's think of something that's really easy, functional on their person, that's not going to disrupt them in the middle of the class if they need to do it. Although like coping calming boxes in my cozy corner in class might be awesome, you know, does your individual have access to that 100% of the time? No. So these skills are really good to teach in addition to using some of those things. So deep breathing or belly breathing. So teaching the individual how to breathe from their belly instead of their chest, and making their belly go out and in. Sometimes I use as an example, like lay on the ground and put something on their belly, and I'll say, okay, now make it go up and make it go down. Some variations or fun things to turn it into might be smell the flower and blow out the candle. So I'll say, okay, smell the flower, and then you pretend to hold a bouquet and go, and then blow out the candle. My son really liked dragon breathing. So you breathe in and you kind of like breathe out the fire. So, and he thought it was hilarious. But you can make it anything that just helps your kid take slow, deep breaths in and big breaths out. Progressive muscle relaxation. That's essentially where you tense all of your muscles and you can kind of go head to toe and then release them. So if you did your fists, you would squeeze, squeeze, squeeze. Some people say squeeze the lemons, and then you can kind of like make it loose and release it. Or the shoulders and arms, you squeeze them tight, and then you make them loose and make them floppy. There's also YouTube videos that go through all this, and there's some of them that have like a script and talk you through it if you wanted to learn more detailed way of doing these things. But a lot of times you go head to toe. Grounding techniques. So that's just kind of ways to bring you back into the moment. So one thing is you can look around the room, try to identify 5 things you can see, 4 things you can feel, 3 things you can hear, 2 you can smell, and 1 you can taste. Another one is counting your heartbeats or counting your breaths. Those are grounding techniques. So there are some others. But a really good thing to do is also the parent teaching, prompting, and modeling. So for example, I tell parents to think out loud. So if you stub your toe, you may be like, oh, that hurt. I'm going to take deep breaths. Or, you know, if you're sad about something, it's okay. Talk it through. Like, I'm crying because, and now I'm going to try these things to make my body feel better. The more that you can model, and especially in authentic, genuine situations, the better. And then you can also encourage your individual to do it for you. So when I think about emotions and emotional regulation, it's not a skill that's expected. I think in a typically developing individual, I think it's between 7 and 12, the individual can regulate their own emotions. Until then, the adult has to stop them. So for example, if your child is frustrated and angry and escalating and they're 5, we're not expecting them to be able to regulate their emotions and calm down on their own. You're going to have to intervene, prompts for these coping skills, do them, model them together, and then help your individual through it. So just, you know, being aware of developmentally appropriate expectations as well. Reinforcement versus a bribe. So I think this is a really important distinction. If you offer your individual something after the behavior has already occurred, that's a bribe, and it's not going to be effective. It'll be effective in stopping the behavior in the moment, but not effective in long-term behavioral change. So the next time, for example, this comes out a lot when you're in a store. So you have your kid at Target, they see the doll babies, they escalate, and then, you know, because they want the doll baby and you said no, they keep escalating, and then eventually you give in because it has become so disruptive to your shopping trip. That's a bribe. So they they wanted it, you said no, they kept escalating, and then you said, okay, like if you stop here, you can have this doll baby. So the behavior happened and they got it. Now, a different way to think about it is reinforcing. So if you do X, Y, and Z, then you can have this. So the behavior didn't happen yet. You set up the expectation ahead of time, and then they could earn it. So I'm not saying like every time you take your kid to Target, get them a doll baby. That was just maybe an inflated example of an expectation. So you could say, if you sit in the cart on your bum, if you use an inside voice, and if you do this, then you can have a snack from the aisle on the checkout. But the behavior didn't occur yet. It was set up ahead of time. The child meets the expectation to get the reinforcer, the motivator, whatever you set. Trying to figure out motivators and reinforcers can be kind of difficult. So what is reinforcing for your child? I have no way of predicting that. You're your expert on your child. So trying to come up with a list of things that your child will work for. The example that I give is that I really like ice cream, but I'm not going to do psychological evaluations for ice cream. So even though an individual likes something, that doesn't mean they're going to do hard work for it. So really trying to figure out, what is going to be motivating, what is going to help encourage the positive behavior to occur. So some things, verbal praise, maybe that's enough for your kiddo. Maybe cheering them along and getting excited and doing a dance party is motivating and reinforcing. Maybe it's a treat. Maybe it's one-on-one time with an adult. Maybe it's doing a special helper task or getting to call their favorite cousin. These are all things that you're going to have to think through ahead of time when you're thinking of behavior planning. When I think about behavior systems, there's two main kinds, and the technical terms are token economy and response cost. A token economy is when the individual earns points or rewards or tokens that then they cash in for something bigger. And a response cost system is where they earn these points or tokens or reinforcers, but they can also lose them. So if they do positive behavior, but then they do some type of challenging behavior, they can lose the token or reward. What the research has found is that the token economy behavior system is more effective for long-term behavioral change than the response cost, but these are two kinds that are used really frequently. So token economy system might be the kiddo earns a bouncy ball in the jar for each kind word that they say to their sibling. And then once the jar is full, they get ice cream. Whereas opposed to response cost, that would be a ball goes in the jar for every positive thing, but then mom or dad takes away a ball for every time they say something negative. And then my last slide, this is just, I wanted to show you a couple things that some of the visuals. So a visual schedule, I know I already kind of showed you, but I wanted to give you more of a lengthy look. So I have it in the wrong.
Dr. Santamaria, would you be able to unshare your screen so we can see you larger?
Sure.
Thank you.
Did that work? Did that work okay, Meredith?
Sorry, I'm answering you while I'm on mute. Yes, you're good.
Okay. So this is an example of a visual schedule. I know I held it up earlier. I should have something behind it. Okay. So it's a morning routine. So it says get dressed, eat cereal, brush teeth, and then you're going to go in the car. So this is a visual schedule. These are the tasks we need to do. And then the reward is this thing. So whatever you guys, the kiddo maybe chose as the reward, and maybe that's getting to choose the song in the car. I'm sorry, there's a glare. And another way to do this, it's kind of the same thing. So this is just laminated. I found these black and white cartoons on Google. So use the bathroom, get dressed, eat cereal, brush teeth, and then the kiddo gets computer time. So this is laminated, so the kiddo can check it off, or you can draw a smiley or whatever. So there's many different variations on what a visual schedule can look like. And you can kind of turn it into that reinforcement system where there's something at the end of the tunnel that kind of reinforces the behavior and they're excited to earn. The other visual, I know I showed you guys this before, was the stop sign. This is really helpful for kids that elope or dart. For transitions, I just wanted to show you guys again. Here's the timer. I like the ones that have the lower numbers on this side because they have it both directions. So I like that the red disappears as the time runs out, but you can get it the opposite way. It's called a time timer. I bought it on Amazon. And then you could also use for a time timer an hourglass. So obviously you can use something like this. And when the sand's all gone, time's all up. It's a really good visual. It kind of takes you out of the situation. One other thing is called, the fancy name is task analysis. It's almost like a visual schedule in the sense that it tells you like all the parts of the things of the task that you need to do. So it breaks a task down into different steps. So for hand washing, I'm sorry, this is so small, I don't know if you can read it. When it breaks up hand washing into different steps, you might tape this by your thing. It says, turn on the water, wet your hands, put soap on your hands, rub your hands and fingers together, rinse your hands, turn off the water, dry your hands. So if that's the task that your individual is working with, this visual could be really helpful to promote success with that. I'm sorry, that's terrible. The glare.
We have a question from Nicole. Go ahead.
Sure.
Hello.
Hi.
I do have a question, and I don't know if this is more individually based that you can help me with, but Skylar she's not reward based. So if I mention, hey, let's go to the bathroom or let's do this, like, and you can get this, she will, as soon as you mention something, she wants it.
Mm-hmm.
Like, there's no like, okay, I hear you, so I'll clean up my toys and then reward. She hears reward and I want it now. Okay. So I don't know. That has been my problem for a while, like getting her to understand you have to do something to get something. Mm-hmm. So how would you rephrase
So she is motivated by it. She just has difficulty waiting for it.
In a sense, yes, that's exactly it. She has no patience.
Yeah. So for toilet training, we talk about making a toilet specific reward or reinforcer. So an expectation that you might set up ahead of time, sit on the potty, then you can have bubbles, or sit on the potty, then you can have the book. So she doesn't get the item until she does it, whatever it is that you want. So getting her into the bathroom might be something that's difficult, and you kind of have to break this down differently, or maybe present it differently or set it up ahead of time differently. But the item that you motivate the child with, especially like a toileting example, would be something that the child doesn't have access to at other times. So for example, if you want to use the iPad or playing with a phone as being the reinforcer, the kiddo cannot have access to it any other time throughout the day, because then it loses its motivation. It loses the strength of the reinforcer. But if, sit first, then iPad, or sit first, then phone. And, the individual might need to be shown how to sit. You might have to model it. You might have to physically guide her. If she's resistant to going, I wouldn't necessarily recommend like tackling her and bringing her into the bathroom, or physically forcing it, but figuring out how to motivate her to get in there. And it might be progressive steps. So it might be, just standing in the doorway gets her the reinforcer, then standing in the bathroom gets the reinforcer, then sitting on the toilet, then going, actually having a tinkle gets the reinforcer. So progressive, they call it shaping the behavior, like progressive steps to the completed task. I don't know if that answers your question.
That definitely helps. Yeah. I'm trying to get her like to do line strokes and different things like that during therapies. And everybody probably has the same problem with virtual therapies right now, where the kids won't sit still after.
Yeah, it's not as engaging. You're not getting the same human contact. It's not as fun.
Yeah. So it's just, I've been trying to think of like, we've been trying to come up with like, okay, let's do these line strokes, and then you can get, a Reese cup or something. And honestly, she shuts down even then, and she wants the Reese cup. So I was trying to figure out the best way to engage her, let her understand a reward system, because she doesn't seem to understand, do this, then get this.
What about like your turn, my turn, or first lines? Then I'm not sure how a therapist is set up and if there's a way to share the screen, but some therapists will do like a game or play a video. First this, then you can press play, or you do it, then I'll do it, trying to figure out a way. Virtual is hard. It truly is. It's just so not hard. As reinforcing or engaging. But I think like alternating a non-preferred with a preferred tends to be helpful. Like just that first, then, first this, then music, first that, then dance party. Maybe you do it first. So you might be like, mommy does it, then Miss Sarah does it. Okay, now you do it, then Miss Sarah does it. You model it for her.
Definitely. Well, thank you so much for that.
Sure. Were there any other questions?
I have a question. This is Erin.
Hi.
So my son asks for things like he wants his shake after he eats, or like we're sitting on the couch and he says shake, and he's allowed to have a shake, but I don't want to get up and get it at that moment. Like I'll say, okay, just a minute, but he will continuously say shake, 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 and like relentlessly, like he can have it, but just not right this second. How can I get him to understand, like, please wait a minute and then you can have it? Like,
is this delay, a milkshake?
Well, it's like his Pediasure. It's like just like a drink, like his milk or whatever. Yeah. But he's like, which he's allowed to have. It's like fine, but
yeah,
it's just not always like convenient or like not right at this minute. But in 5, how do I get him to understand, like, yes, but you must wait, without him like flying off the handle about it?
Sure. So it might be one of those things where it's a skill deficit and you have to teach. They call it like teaching a wait protocol. So you're essentially helping the individual wait longer and longer amounts of time till you get to that goal. So maybe it's like wait 10 seconds and you set a timer, and then the next time, well, you probably do that for a little bit until he's successful and doesn't show distress, and then you increase it. If it's something that he's physically able to get himself, but he's trying to control you and make you get it for him, then I would just, tell him that he can get it himself if he's physically able. So it really just depends. But my guess is that teaching him to wait, using a timer, you might, pull out the timer and say, when 5 minutes is up, then I'll be ready. Like if you're in the middle of helping another child do something and you just can't do it right then, using a visual or a timer might be really helpful.
Okay. Thank you.
Sure.
Anyone else? Is that all of your, I didn't want to cut you off. Is that all of your examples?
Yeah.
That you wanted to share with everybody?
Yeah.
Awesome. Does anyone else have any questions? Because that was all fantastic information. We did have one parent ask about the slides.
Mm-hmm.
So I didn't know if that could be something that we can include with the recording when we send out to those who registered. Would that be okay?
Yeah.
Okay, awesome. So what I'll do is I will follow up with everyone that registered with a link to the recording later this week, as well as Dr. Santamaria's slides for your reference. Okay, so thank you much, everyone. I appreciate you joining us, and be on the lookout for that email. Thanks again, Dr. Santamaria. Have a great night,
everyone have a good one. Thank you all for having me.